I'm going to be going over a way for you to determine if your patient is safe to ambulate after receiving anesthesia from a surgical procedure. For general anesthesia, your patients tend to be extremely lethargic. Sometimes they tend to be nauseous and have a tendency to vomit. So what you need to do is you need to check their vitals as well as check their alertness level. If all of that is good, then you can proceed with mobility. For local or spinal anesthesia, you're going to want to check their blood pressure and all their vitals, make sure that they're normal. If not, you're going to want to wait because the spinal might not be worn off yet. If it is, you can go ahead and proceed to assessing their sensation. If the patient has normal sensation in their lower extremities, then you can proceed to the mobility aspect. If they do not, you're going to want to see if your patient can actively dorsiflex, perform glute set and quad set while sitting. If they're not able to, out of bed activity is not indicated due to their potential risk of fall and the anesthesia not being worn off yet. If they are able to perform those, you can have them perform a sit to stand transfer. If it requires min assist or less, you are safe to proceed to a progression of a mobility assessment. If it requires more than min assist, you're going to want to have 2 people just in case. For the mobility assessment, in standing, have the patient perform a mini squat. If they do that without a problem, have them take a single step forward with their surgery leg and then bring it back, and then the same with the non-surgery leg. If they buckled, you're going to want to return them to sitting because the spinal has not worn off yet. If they don't buckle, then you are safe to proceed to a transfer and gait assessment. And that is a way to determine if your patient is safe to ambulate.